This presentation is day 5 and it is looking at Unit 2, which is Understand the Principles and Values in Health and Social Care, Adults, Children and Young People, Early Years and Childcare. It's part of the Level 1 Certificate Introduction to Health, Social Care, Children and Young People settings. The aims and objectives of this session are that you will know the principles and values that underpin work in health and social care, including adults and children and young people, early years and childcare. And you will know ways to respect and value those who access services in health and social care, and again, including adults and children, young people, early years and childcare. As always, remember to look out for the boxes on each of the slides to inform you of which question the slide relates to.
Some important words for this unit. So this is going to relate to all of your unit, just some important words to get you started here. So you'll see the term principles and values coming up a lot because that is the main focus of this unit. So principles and values, what that means is the main beliefs and ideas of an organisation. So in terms of what we're looking at today, principles and values are relating to health and social care. The next one says guidance and standards. So guidance and standards means the rules and guidelines that need to be followed in a workplace. Respecting and valuing. So towards the end of the unit, you're going to show how you're going to respect and value the service users using the underpinning principles and values. To enable you to understand what that means, respecting and valuing means to show care and consideration of others' views and opinions. So we're going to think about that service user. Person-centred practice. So when you are working in health and social care, childcare with young people, you should always be focusing on the person, the young person, the child. So what this means is listening to the person and meeting their individual needs in the way that is best for them. So it avoids us from treating everybody the same. Confidentiality. So you'll probably be more familiar with this term, so only sharing information with people that need to know or can offer help. Self-esteem. So we looked at self-esteem previously, and this means feeling good about yourself and feeling confident in yourself. So we're going to have a look at what principles and values are that underpin the work in care. So we all have different principles and values, and we learn those from people around us. So if you think about the way that you behave at home, some people will take their shoes off at the door, but others are quite comfortable walking around their house in shoes. Both of these examples are different, but it just depends on what is right for that individual. So in my house, I prefer shoes off. I don't like the outside coming into my house. I prefer to have clean floors. But for some people, like when I go to my mum's house, she's not bothered. I don't really know where I get it from. Actually, I do know where I get it from. I lived in a flat with very, very cream carpets and they didn't want to lose my deposit. So there you go. I had to think about that though. But there's no right or wrong way. It's just what is right for yourself and your family and your house and your life. So when we think about principles and values in health and social care, we need to follow the values and principles that are set from the place of work where we're in and not our own principles and values. So if we think back to that previous example, if you are a shoes off household like me, you may wish to not walk around in your shoes, but obviously in the workplace you can't do that. It's against health and safety policy, so that's not going to work there. That's why it's so important that we follow the values and principles of the setting where we're working in and not our own values and principles. So there are many important values and principles in health and social care, and we need to understand these to make sure that we are working professionally. because these are going to underpin all of the work that you do. They're going to have a stand in everything that you do in care. And really what they're there for is to make sure that the service users, whether they're adults, young people or children, are there being cared for in the best way possible. So I've got some examples of the principles and values here. So I am going to work through these on the following slides after this slide. So we've got showing empathy, person or child-centred support, confidentiality, keeping that maintained, inclusion, finding out people's wishes, likes and dislikes, meeting all needs, safeguarding children and young people, safeguarding vulnerable adults, respecting people's culture and beliefs, communicating in a positive way, giving people choices. So these principles and values underpin everything you do in care. So these are like your sort of guidelines that you need to be following when you work in a care setting. So the first value and principle we're going to look at is showing empathy. So what does empathy mean? Empathy means the ability to understand and share the feelings of others. So when we are being empathetic, we are thinking about how that person may be feeling and trying to understand things from their perspective. It's different to sympathy. Sympathy is more about feeling sorry for the person, whereas empathy goes that bit deeper, where we're trying to really understand how they're feeling. How can we use empathy in health and social care? So you can listen, first of all, to your service users. Make eye contact when you're caring for them, show them that you are there. And you can ask them how they're feeling and obviously start a conversation from that. If they're saying they're in pain, you need to be able to say, obviously get a nurse to get some paracetamol or something, but you need to say, oh, I know it's been difficult for you at the moment, I'm here for you. Person-centred support. So we looked at this at the very start of the unit. So it is listening to the person and meeting their individual needs in a way that is best for them. So some examples of how you could use person-centred support in health and social care. Firstly, allowing them to be part of their own care plan. Let them have a voice in their care plan. Let them plan their own care. What do they want their care to be like? Perhaps you're working in a hospice and you're trying to plan out what that person would like from the rest of their months that they've got left to live. You know, what kind of activities do they enjoy? Do they want to be having their nails done and being pampered a little bit and made to feel sort of special in that way? Or would they rather be doing, when they've got the energy, some sort of more active activities? Ensuring that service users still have their human rights. So making sure they are being treated with dignity and respect, and making sure that they still have the right to complain. Help people to live as independently as possible by doing things they enjoy. So it could be that you are working in a care home and somebody particularly enjoyed playing tennis when they were sort of more able. There's nothing to stop you from using the courtyard outside and perhaps playing a bit of tennis out there. When I worked in a care home, there was a lady who had previously been a nurse, and she had dementia. She was the most settled when she was given a piece of paper and a clipboard because she felt like she was at work. So that was being person-centred to her because it's what she enjoyed. Allowing the service user to have choices. So this is everything. Examples like clothes, food, where to sit, what to do. Everything about what they would like to do with their lives, from the day-to-day things to planning ahead. They're allowed to have choices. Confidentiality, so making sure that is maintained or kept. So what that means, again, we looked at this one at the start, so only sharing information with people who need to know or those who can offer further support. So we're not going to go home to our partners, our children, our mums, our dads, and say, "Oh, Doris at the care home today, you should have heard what she said to me." No, it's not relevant. You know, people don't need to know what's been shared with you, what's happening. So how could you use this in health and social care? So you're going to keep information private because it maintains trust between you and the service user. It builds stronger relationships as well between your staff, so it can help the service user to open up, knowing that not everybody is going to find out. And it can help them to keep them safe from abuse as well. Inclusion. So inclusion is a bit of a funny word. Inclusion, the word comes from the word include. So what that word means is to accept all people, regardless of their age, their gender, disability, any medical needs, or any other differences they may have. So what it means is that everybody has the same opportunities. It doesn't mean that people will all be treated the same, because we need to respect those differences that people have and that they might need a bit more help than one another. So how could you use this in health and social care? So you could make activities as accessible as possible, so making sure the table is at the right height for a wheelchair. Sometimes when people use electric wheelchairs, they are particularly bulky and particularly high, and so the tables are often too low and the person can't get involved because they can't physically get to it. They're stuck sort of behind the table and they can't reach anything, so it's not accessible for them. So a way to ensure that they're included would be to make sure the tables are the right height, maybe get some adjustable tables. Another example would be allowing people in a care home to sit together at meal times if they wish to. There's nothing to stop you from asking people would they like to sit together. If they would, great. If they wouldn't, also great. But we're not going to exclude anybody from that opportunity. The next one, allowing young people to access education in college if they were previously denied because of their differences. So perhaps they were told, "Oh, you can't go to college because this, that and the other. You know, you've had problems in your life and it's not suitable for you." It's not the case. Everybody has the right to have the same opportunity. They might just need a bit of extra support to get there. Finding out wishes, likes and dislikes. So what does that mean? These are the preferences of the service user, and it really helps us to give that person-centred care that we looked at before. So how could we use these in health and social care? You could find out what they wish for the future. So perhaps you are working with somebody that would like to be stronger and less dependent. Perhaps you're working with somebody who's had a stroke and they are struggling to use the right side of their body, but they're right-handed and they would quite like to be able to become less dependent, and perhaps they're not able to build that strength back in their right side, but they could learn to do things with their left side, which would make them stronger and less dependent. Just an idea there. Finding out what they like. So this could be, like I said before, like about tennis, it could be something like that, something that they enjoy. You could start a new activity based on a hobby that somebody had before. Perhaps people have been really into sort of painting with watercolours or something. It'd be quite nice to introduce a new activity based on hobbies that people in the care home previously had. You also need to find out what people's dislikes are. So we're not going to assume that everybody is going to want to join in with everything, just like you and I. There'll be things that you don't enjoy or don't like to eat or drink and things, and that's perfectly fine. So we don't need to encourage something that people aren't interested or bothered about. Meeting all needs. So in order to meet all needs, we need to think about the activities of daily living, okay? So the activities of daily living become the basis of a care plan for service users. So this is something that care homes, support work agencies, mental health hospitals will use to make sure that they are meeting all the needs of the person. So the activities of daily living are to maintain a safe environment, communication, breathing, eating and drinking, eliminating, that means toileting, personal cleansing and dressing, controlling body temperature, mobilising, working and playing, expressing sexuality, sleeping and dying. So I'll just talk a little bit more about these. So not everybody will have needs that need to be met in some of these activities of daily living. Okay, so maintaining a safe environment. Let's think about if you're working in a care home with people with dementia. In order to keep people safe with dementia in a care home, you need to make sure the doors are locked so that they're not able to just sort of wander out. They're normally on like a magnet lock with either a buzzer or a key code on. Communication, so you're going to think uniquely, how can this person communicate? Perhaps they need you to speak slower, perhaps they need you to use shorter sentences. Breathing, so most people can still breathe on their own. This one will really come in when somebody is in hospital with a chest infection, or if they're ventilated, where they have a breathing tube in. So if that's normal, you'd just put normal. Eating and drinking, so you could put that they have a sort of an average diet, there's no special requirements there. It could be that the person is Muslim and they don't eat pork. Eliminating, so here is where you're going to talk about continence or incontinence. So if they have a normal regular bowel movement, that'll be noted there. If they need a bedpan, if they need a commode, so a bedpan where they are going to go to the toilet in bed with two carers. A commode where it's like a wheelchair with a little slot underneath where there's a removable sort of toilet piece. It's hard to describe. But that's a commode, so those things would be noted there. If they don't have any problems with going to the toilet, you would just put normal continence there. Personal cleansing and dressing, so again, if we're thinking about people in a care home for people with dementia, they'll need varying levels of support. Some people might need a prompt, so you would put in their prompt to wash and dress. Some people would need more support depending on where they're at with their dementia. Controlling body temperature, that can be something as simple as helping somebody to recognise when they're too hot, like taking their jumper or their cardigan off, or if they're too cold, putting the jumper on, putting the cardigan on. People with dementia might not recognise that any longer, but again, it depends on the severity of the condition. Mobilising, so that's walking around, ability to go from sitting to standing on their own. That's going to be where you think about fall risk assessments as well. Are they going to be falling over? Working and playing, so what activities do they enjoy? What did they work as in the past? Expressing sexuality, so if they have a wife or a husband still who's alive, or perhaps they've passed away. But also remembering that just because somebody is in a care home doesn't mean they no longer have sexual needs. And so, for example, I worked in a care home where there was a gentleman that each morning he would be passed, we call them bottles, so normally it's where men would urinate in, but he would ask for the bottle for other reasons, and he would use that bottle and then just ring his bell when he was done. People still have the right to be able to do that as part of their human rights, obviously, to be able to express their sexuality. The next one's sleeping. So any considerations or concerns with sleeping would go in here. So if you're working with somebody with dementia, again, it might be that they are, sometimes they're given sleeping tablets to stop them wandering at night. And the last one is dying. So what are their dying wishes? Perhaps they are religious and they have a particular need. Perhaps in their culture there's a different need. Something to think about there. So I hope I've explained that okay for you, the activities of daily living there. And of course, these aren't just for care homes for the elderly, they are for health and social care across the board. Like I said, if it wasn't applicable, then you would just put not applicable or normal. Safeguarding children and young people. So safeguarding, what does it mean? It means protecting children from harm, abuse or neglect. How could you use this in health and social care? So you're going to report any concerns of safeguarding to the safeguarding officer. You're going to ensure that you keep up to date on your safeguarding training. You'll reassure the child, but you'll also have to tell them that you need to report it and you cannot promise to keep secrets. That is so important. With vulnerable adults, the same again, but service users this time. So a vulnerable adult is somebody over the age of 18 that has a disability or medical need where they need protecting from harm, abuse or neglect. Again, you need to report your concerns to the safeguarding officer. Make sure you keep up to date on your training. Reassure the service user, but again, tell them that you're going to have to report it and that you can't keep secrets. Respecting people's culture and beliefs. So what does this mean? So culture means the ideas and social behaviours of a particular group of people. So for example, Afro-Caribbean culture. And beliefs means religions they may have. So how can you ensure that you are respecting people's culture and belief in health and social care? So you need to make sure that you're trained in equality and diversity. You need to keep up to date on the changing attitudes. You can do this by reading books, watching documentaries, just keeping your mind active on the ever-changing sort of cultures and the way that the attitudes are changing. Like if we think about the BLM or the Black Lives Matter movement at the moment, that's a key example there. Remember that different cultures often have different practices. So some people, for example, don't make direct eye contact. Some people will nod their head for no and shake their head for yes. And you need to make sure that you're understanding what that person is saying. You need to ensure their diet reflects their needs, their wishes and their preferences, but also that it respects their cultural beliefs. Like some people won't eat pork, some people will perhaps be vegetarian. There are lots of differences that people could have in relation to diet. Communicate in a positive way. So what does this mean? If we are communicating positively, this means that we're giving messages in a positive way, even if the content is negative. So it's supportive and it's done with emotions. So how could you do this? You could speak clearly. You need to think about your tone of voice. You don't want to be monotone. Sounds a bit boring. You need to listen carefully. You need to have confidence in what you're saying, so you don't want to be doubting yourself. You need to be friendly. And you also need to think about your non-verbal communication, like your body language. So don't fold your arms because that's seen as very negative. Giving people choices. So choices meaning choosing between two or more possibilities. So this could be a choice of tea or coffee or a cold drink. It could be whether they would like to wear a jumper or a cardigan or a shirt that day. It's asking them, what would you like to do today? Where would you like to sit? Not just being the decision maker for them. So now I would like you to identify 6 or at least 6 of the principles and values that you need to work in health and social care. For each example, I would like you to use a supporting sentence to demonstrate your understanding of what the principle or value is. So I hope that was lots of information for you to take in. Please use those slides as inspiration, but do feel that you can use further examples if you would like to, or you may wish to do further research. Please pause this video here whilst you answer that question. we're going to look at the guidance and standards that support the principles and values that we've just looked at. So, the guidance and standards are the rules that need to be understood to make sure that the values and principles are followed by everybody in the work setting. And this is whether you work with children, with young people, or with adults within health and social care. So the ones we're going to be looking at here are the Equality Act of 2010, the Early Years Foundation Stage, or the EYFS for short, which was brought out in 2017, or updated in 2017, the Health and Social Care Act of 2012, and the Care Act of 2017. We're also going to look at some codes of practice. So the ones we're going to look at are the General Social Care Council, the Special Educational Needs and Disabilities, or SEND for short, and the Nursing and Midwifery Council, or the NMC for short. So firstly, let's think about the Equality Act of 2010. So in 2010, the Equality Act brought together many different laws that link to equality, diversity, and treating people fairly. This law is there to protect people from discrimination, and it has many protected characteristics. Some of those are race, so you're protected from discrimination against your race, you're protected from discrimination against your age, your religion and beliefs, you're protected from discrimination about your disability, and you're also protected about your marital status or whether you're in a civil partnership like a homosexual couple. The Early Foundation Stage, or the EYFS, these are guidelines for good practice that need to be followed to meet high standards in childcare. So this covers the ages of 0 to 5, and it's followed by most care settings for educating children during that age range. So it covers childminders, day nurseries, and nursery schools. So it sets out good practice as to what good standards in childcare are for people who work as childminders, people who work in day nurseries, and people who work in nursery schools. The Health and Social Care Act of 2012. This is about improving choices and standards of care available in health and social care. It supports professionals to work in a way that best meets the needs of individuals that are using the service. So that's whether the service is a care home for people with dementia, a care home for the elderly who perhaps have physical needs, a supported living environment for somebody with learning disabilities, a mental health secure unit. It covers all of those places to make sure that professionals are working in a way that best meets the needs of the individuals. So it relates very much to the person-centred care that we looked at in the values and principles. The Care Act 2012. This law encourages caregivers to take a person-centred approach when safeguarding vulnerable adults. So when people are working and caring for vulnerable adults, they're also safeguarding them, and the Care Act is there to make sure that the person-centred approach is being adhered to. So now we move on to the codes of practice. The General Social Care Council. This makes sure that care is professional by ensuring social care workers protect the rights of the service user. It says that staff are responsible for the quality of the care they give and that they must keep their skills up to date. The Nursing and Midwifery Council, or the NMC for short. This is for qualified nurses, but as you'll be working under qualified nurses, you will be able to see what the qualified nurses will be expected to do and what they're expecting of you. So they work by the 4 P's, and these are prioritising people, the people being your service users, practice effectively, so doing your job correctly, preserve safety, so maintaining that safe environment and safeguarding vulnerable adults, and promoting professionalism and trust. For question 2, I would like you to identify the standards and guidance that underpin the principles and values. So for this question, what I would like you to do is write the number of examples needed in part A and part B below, and then write a supporting sentence just to show your understanding of each example. And again, you can use my work on those previous slides as your inspiration. You don't need to go off and research laws because it is very heavy going. So your 4 items of guidance and standards for part A, and then a short sentence just to show what you understand about those guidance and standards. And then I just need 1 code of practice for England on part B. So you could choose, for example, the NMC there, the Nursing and Midwifery Council. Please pause this video here while you complete that question. Respecting and valuing service users as individuals. So the guidance and standards that you just looked at previously are in place to make sure that when you're working in health and social care or in childcare, that everybody working is working in the same way that respects and values the needs and wishes of everybody, no matter who it is that you're working to support. So it is so important that people who use the services are valued as individuals so that they feel valued as people. So how can we show that we respect and value people as individuals? We could listen to their wishes. We could understand their needs. We could know what they like and what they dislike. And we can show that we value the service users' opinions. What effect can respecting and valuing service users as individuals have on that service user? So if we're able to value and respect that service user, it could make them feel more confident to make choices for themselves. They could feel like they have that voice so that they're able to continue making decisions for themselves. Just because somebody is receiving care for some aspects of their life doesn't mean that they have to rely on a care worker for everything in their lives. It could lead to more trusting relationships between service users and care workers. So if they know that they're being respected, they know that they can speak to their care worker, especially their key worker, about something that perhaps is bothering them or something that they would like to change about their care plan. And it helps the service user to feel more in control of their own lives. So think about yourself for a moment. If you were tomorrow, for whatever reason, something happened to you and you found yourself in 6 weeks' time living in care, relying on somebody to wash and dress you. You're at the age that you're at today, and in 6 weeks' time, that's not going to change by much. You would still want to be in control of your own life. Perhaps you still want to scroll aimlessly on Instagram and Facebook before you go to sleep at night. I know that's what I end up doing. Perhaps you want to watch a horror movie on a Saturday night. Perhaps you want to get a takeaway on a Friday. You've got to allow the service user to feel more in control of their own lives to promote that independence and promote them to have good confidence levels. When people know that others are interested in their views and opinions, it makes them feel respected and valued. So I'd like you to now answer question 3. Describe why professionals working in the sector should value individuals who access services. So I'd like you to develop a paragraph of about 3 to 4 sentences here to answer this question. You can give examples like I did about perhaps relating it back to yourself. What would you like? So how could professionals support you and value yourself? Because that shows your understanding of why it's important for the individuals that you'll be working with. Pause this video to answer this question. Let's think about some ways to value adults in health and social care. So we're just thinking about adults at the moment. So to value an adult, I would give them time to speak and I would listen to them. By giving them time to speak, I'm not going to be talking over them or talking for them. And by listening carefully, I'm going to make sure that I've heard what they've said and understood it. I would also communicate with them in a way that suits their needs. So I would be valuing them by allowing them to communicate with me and for me to communicate with them in a way that suits them. Perhaps they have had a stroke and they have weak muscles in their mouth and they struggle to pronounce words. So perhaps they speak slowly but want you to speak at normal pace because they can hear perfectly well. They just struggle to get the words out themselves. I would like you to now research 2 more ways to value adults that access services in health and social care. So now you should have 4 examples of ways to value adults that access services in health and social care. Please pause this video to answer question 4. Now we're going to think about ways to value children or young people in health and social care. So I've got 2 ways here, providing activities that they're interested in. So there's no use trying to encourage a child to play with dolls if they're not interested in playing with dolls. You're not going to be able to form a relationship with them by trying to play dolls with them if they're not bothered. Instead, if they're interested in playing with dinosaurs, then play with dinosaurs with them. Play with something that they enjoy. The same is with young people. So if we think about teenagers, if you're trying to relate to a teenager and you're trying to talk to them about perhaps a band or a celebrity that you're aware of, that you think, oh, they might like this person, and they're really not interested in what you're saying, perhaps you're talking about the wrong genre of music and they're not at all bothered about it, then you need to get back down to their level. What do they like to listen to? Provide some activities around that instead. Ask for opinions and give them choices. So you need to do this with children, asking, what would you like to play with today? Would you like to have a sandwich or pasta? With young people, it could be asking them, what time would you like to go to bed? And trying to work with them on a sensible time, but allowing them to feel like they're in control, even though you're going to suggest probably a bit of an earlier time if they're suggesting midnight and they've got school the next day. I would like you to now research 2 more ways that you could value children and or young people who access services in health and social care. This should lead you on to question 5, so you should be able to give 4 examples of how to value children and young people who access services in health and social care.